Good afternoon, and thank you for joining us for the February 9th COVID-19 Virtual News Conference. My name is Christine Messenger, and I'm one of the Public Information Officers here at the Joint Information Center. Today, we're joined by Humboldt County Public Health Director Sofia Pereira and County Health Officer Dr. Ian Hoffman. Director Pereira, would you like to give us a few opening comments?
Yeah, good afternoon, everyone. So just a couple things I wanted to touch on real quick. So first of all, I just wanted to give an update on the Joint Information Center call center numbers because they continue to field lots of community questions. So since the beginning of the opening of the Joint Information Center, we've had 60,702 emails and calls. And then year to date, so far, we've gotten 2,368 emails and calls into the call center. So grateful for our team that are fielding these questions, our public health nurse that also is on standby to help answer questions as they come in, and just grateful for the community that's utilizing this resource to make sure that we're getting people with the guidance and information that they need in this pandemic. And then also just wanted to note, we have our dashboard, we have our daily news releases that we are doing. And now that we're 2 years into this, we are we're really looking at how we present the information. We've been working on a new version of our dashboard that we're hoping will have more information for you soon as we get closer to the launch of that. And so with some of those changes, with how certain data has become more or less reliable, like our daily case number reporting has greatly changed with the advent of home tests. It doesn't give us the full picture like we used to have. So we're going to be looking at changing the frequency of how we report some of that data. And so we will at some point soon be moving to 3 times a week, doing news releases 3 times a week versus daily, to help reflect this change that we're seeing in the data, and providing still those updates to the community. And I just wanted to make sure if there was anything else around that. So that's really the purpose of this update, just to clue you in that that's something that we're working on. It's not something that's totally imminent, but it's going to be something hopefully in the near future, and we'll definitely follow up and give you a heads up when that's getting ready to launch, both the dashboard and implementing the 3 times a week of the news releases and the case reporting. Thank you.
Thanks, Sophia. Dr. Hoffman, would you like to share an update?
Yeah, thanks, Christine. Thanks, Director Pereira. Let's start today with a brief update on the Omicron surge. We are solidly on the other side of the peak now here in Humboldt County. Our case rate for this surge is now about half of what it was at the peak. As of today, the test positivity rate continues to drop, although still at quite high levels, but certainly all the signs are pointing to the fact that we are past the surge. The hospitals are doing better this time, still managing large numbers of patients, but seems to have less acuity this time. In terms of the patients there, less ICU stays, shorter stays, and just less severe patients in general. And it appears that deaths from this surge will also be less than the previous surge with Delta, at least here locally for Humboldt County. So I think that's really good news, and that all of that has been taken into consideration with the decisions to remove our local mask order and allow the state's mask order to prevail. So we're working on the final document that we'll put out in the next few days, but fully expect that on February 16th there will be no local masking order, and it will be the CDPH masking order. Which, just to give you a little background on what that one contains, so that would be going back to June 15th statewide masking order that requires everyone who's unvaccinated to continue to wear a mask in public settings, and people who are fully vaccinated could, if they wanted to, go without a mask in those settings. However, each setting could set their own rules, either being more strict and requiring everyone to wear a mask in those settings, like they are currently, allowing people to self-attest with their mask, whether they're vaccinated or unvaccinated, or asking for verification of vaccination and asking people who are unvaccinated to wear a mask in those settings. And we continue to have the signage on the Humboldt County Health Alert website for all three of those options that were created back on for June 15th reopening. So that's where we stand. There are still some settings in California that require universal masking. And these are settings of more congregation and where vulnerable people might be more likely to be. So in hospitals, healthcare settings, congregate living facilities, homeless shelters, jails, and then schools by nature that they are truly a congregate setting and that children are in that setting all day long, 5 days a week. So to continue to protect them and keep the schools open and keep kids able to go to school. And that's all the updates I have, and look forward to the questions. Thank you.
Thank you. Let's take some questions. Iridian, do you have a question?
Yeah, my question was about the last county mask mandate. And so when that was set, it was said that we would be able to lift those mandates if we meet 3 requirements. And so far we haven't. So I understand that everyone's kind of feeling frustrated and overwhelmed and done with the masks. But I guess what's the scientific reason or rationale behind lifting this mask mandate?
Great question. And yeah, we have to remember those metrics were set under Delta, and we were working with Delta at the time, which was I mean, each one of these variants is almost like a new virus. They behave and they act differently. And so we saw with Omicron really huge number of cases, and we saw the hospitals doing much better, though, like I just mentioned. So, I mean, I think we're still really taking those 3 metrics into mind, but because the cases are just so high, and I think they'll probably continue to be high, given Omicron, and the case counts, like Director Pereira said, become less and less reliable over time with more and more home testing. We're going to rely more on the hospitals and the vaccination rates. And so I think, again, looking at what happened in this surge, we feel that those 3 metrics, even though they're not met exactly, the game changed with Omicron, and we feel it's best to align with the state moving forward. Now, I will point out, we do still recommend masking for everyone in all settings. The CDC continues to recommend masking for everyone in the substantial and high transmission risk, which we continue to be in for our case counts. So, this is also a progression of our public health policies as we, move closer and closer to an endemic phase. We're going to see less restrictions and requirements and more recommendations. So they might be the same as they were previously a requirement, but they now move to becoming a recommendation and giving people more choice about how they want to implement those, either in their personal lives or in their business or in their community.
Do you have a follow-up, Iridian? Thank you. Ryan?
Can I have 1 minute? I need to formulate something. Come back to me.
Oh, no problem. Christina.
Yes, so my question is, why are you opting for to continue the mask mandate at schools, but not anywhere else?
So Humboldt County is removing our mask mandate. So we are reverting to the statewide requirements and recommendations. So I think, Christina, if you're asking why CDPH continues to require masking in schools through that requirement at the state level, it's, as I mentioned in the upfront, it's a congregate setting where kids are all day, and the sentiment is that by removing the masks at this point, with the case counts being higher, that we would actually be potentially leading to more kids out of school, more school closures, and more trouble keeping kids in school. But Humboldt County is not requiring that. That's a statewide requirement.
Thank you. Christina, do you have a follow-up?
Yeah, my other question was, I don't know if you guys are having some way to track those that aren't vaccinated and how you will be making sure that those people continue to wear a mask.
So the three options for public places will be, as I mentioned, back to what we had put out there on June 15th with the June 15th reopening, which would be that they can require everyone in their setting to wear a mask. They could ask people to verify that they had a vaccination. And if they, could verify that, they would allow them to go without a mask. You might think of, like a membership club or someplace where they might be able to gather that information more easily and implement that. But it's really up to each individual business. And then the third option is just that what we call self-attestation, which means that we really rely on individuals to put a mask on if they're unvaccinated when they go into public places. So those three options are, again, the signage is on the Humboldt County Health Alert website, and we encourage businesses to put up post signage as to which they are going to request their patrons to do in their establishments.
Thank you.
Thank you. Isabella, do you have a question?
I do, thank you. It's actually very similar to Iridian's question, but I'm curious to know, with January being the worst month of the pandemic in terms of case counts and hospitalizations locally, what confidence does public health have in ending the statewide mask or ending the local mask mandate and moving to CDPH recommendation? And what is public health's message to folks who remain cautious about taking off the mask?
Well, I'll take the second part. Everyone is definitely encouraged to continue to wear a mask. I think, case counts are still high, and our recommendation is to continue to mask in public places. This is really about the moving away from requirements to recommendations. As far as, I think I wouldn't agree with everything, the rest of what you said. Case count wise, this was the worst month we've had. These are the highest cases we've seen. But for hospitalizations, it was not, and certainly not for the severity of the hospitalizations or the deaths that we've seen from this surge. So we really saw with Omicron a different scenario, and how much of that is our vaccination rate, which I think has also continued to improve since August 7th when we put in the mask order. And even since November, when we revised it to add those metrics, we've continued to, we've added 5 to 11-year-olds who've now, over 25% have been fully vaccinated, over 30% with one shot. We have continued to increase boosters. We have over 55% of the eligible population who've gotten a booster, which is almost 10% higher than the state's median. And we made great progress in vulnerable populations, with several of our vulnerable populations having nearly 10% higher rates than the state median. nearly on average with the rest of the population. So, all these factor into why we've removed the mask mandate and decided to allow CDPH and CDC recommendations and requirements to be the masking requirements and recommendations going forward.
Okay, and I would actually just follow that with, and you sort of touched on this, but I guess I want to know more about immunity from infection. So, obviously, if you can talk about how herd immunity kind of comes to play in making this decision.
Yeah, great question. So another piece of the puzzle that's come into play since November when we made those decisions was that a large research study from California and New York showed that the risk of once you're infected, your risk of hospitalization with a reinfection is much lower. And we weren't certain of that before. We had studies that showed that people's immune response was not as was more variable after infection than with vaccination. And so that was one big piece of the puzzle we were working on was, what happens though to people after they get reinfected? Are they just as likely to go to the hospital as they were previously? And so now knowing that gives us another layer of understanding to that piece of community immunity, right? So we know that probably a lot of the people who've been infected, their risk of becoming hospitalized on a reinfection is significantly lower. So all these pieces have come together, data that we didn't know back in August and even in November. So progress has been made, and that's really the reason that we're making these changes now.
Thank you.
Thank you. Austin, do you want to ask your question?
Yes, thank you so much. Just kind of going off of what Isabel was saying, yesterday I spoke with residents in Fortuna and Eureka about this decision. One person told me, quote, "I'm afraid we're rushing it. We still have high numbers." And another person saying, "I feel like decisions like this may ultimately affect me negatively because I'm more likely to catch COVID if less people are masked." So how do you reassure residents that this is the right time, the right decision to make at this time?
Yeah, I think we've given a lot of the background for why it is, and I also, just the main answer to that, Austin, is that we still encourage everyone to mask. We're just moving it from a requirement to a recommendation because of where we're at in the pandemic. We have to take these responsibilities very seriously as public health officials. That we need to understand when the right time is to move between those aspects of the tools that we have from a requirement to a recommendation. And given the knowledge that we have of where we're at in the pandemic right now, that appears to be the right time.
Thank you. Austin, do you have a follow-up?
I do, yeah. Just one quick follow-up. So we heard that Mendocino County's public health officer announced that their indoor mask mandate will remain, saying that it would be inviting problems to get rid of it. So why has Humboldt County chosen to take a different approach compared to our neighbors down south?
Yeah, Dr. Corn and I are in close communication on a lot of things, and I respect his opinion greatly. We are also in communication with many other health officers and health directors across the state, and are moving with the vast majority of them.
Thank you. Ryan, do you want to ask your question?
Thank you. Yes. So I was thinking back to Dr. Hoffman, you said we're basically tapering off on the Omicron surge here. So I wanted to see if you had an update possibly on the school COVID-19 case reporting via the SPOT portal. If you could also touch briefly on why that was suspended, the need to import the data there from schools. And yeah, thank you for the update.
Sure. Yeah, so that decision was made at the absolute height of the cases in the schools. And I mean, we were getting, I think at one point we had over 400 cases in schools across the county. And it was overwhelming to the administrations to have to continue to put that information into the SPOT portal. And so it was really a joint decision between Humboldt County Public Health and HCOE and the schools to suspend that temporarily. When we did that, we made it clear that was only, that it was temporary and that we would be reevaluating it in the future. And about a week ago, we needed to reevaluate some of the other policies, and so we decided to reopen the SPOT reporting intake form for schools and encourage them to use that and try to streamline it. Really, there's other ways that they can also report positives in the school. So if they're doing testing, it gets reported to us through the testing platforms that they use from the state. And so if they're doing that, we don't require them to put it into SPOT, because we'll get the data another way. Or if families are reporting through the CDPH website for home tests, which has been created in the last month, then that also gets into our system, and so schools wouldn't necessarily need to report that data through the SPOT. So it's really about not duplicating work and creating streamlined workflows that get the right information across, but don't create extra work for the schools. So it was a temporary fix. And I'll tell you, a lot of jurisdictions did the same. It was, even CDPH was buckling under the caseloads through their system. There were times that they couldn't get all the data to move through. There were just so many cases.
Do you have a follow-up, Ryan?
Thank you. I guess I was just wondering how much of that were you able to determine was duplicative, or was that a big problem?
No, yeah, I mean, we deduplicate all of our cases, so we never report two of the same cases. But what we didn't want was for them to be reporting it two different ways, because it's creating more work for them, and then it would also create work for us to have to deduplicate it when we go through the system and match those up. So by closing the SPOT portal for that short period, I don't think we lost a lot of data, and we really just created a situation that streamlined for the schools to not have to put in duplicate work. And then on the other side, we really created I think a better streamlined process for them, so that going forward there would be less duplication of work.
Thank you. Elizabeth, if you'd like to ask a question and a follow-up, you're welcome to.
Yes. I'm doing a paper regarding COVID-19 and pregnancies. I wanted to know if you had any words regarding the topic of if the vaccine or COVID-19, like how vaccines may affect or pregnant women or pregnancies.
Yeah, great question, Elizabeth. Thanks for bringing that up. COVID-19 and pregnancy is a real concern. There's very good data out there that pregnant women are at higher risk for pregnancy complications, for worse infection than if they were not pregnant, and for loss of the pregnancy. So all of that is taken into consideration by all the medical authorities, who strongly recommend that pregnant women become vaccinated for COVID-19. So ACOG recommends it, the CDC and FDA, and really, I can tell you that we've seen this locally in cases where pregnant women have had much more severe outcomes than non-pregnant women. And so it's definitely a real concern. And so, we encourage everyone to talk to their doctor and get vaccinated for COVID-19 during their pregnancy. Just like we would for the flu. Influenza vaccine is strongly recommended for the same exact reasons.
And actually, if I could just add, just from personal experience, Elizabeth, I was pregnant I was halfway through my pregnancy at the beginning of this pandemic. And for me, it would have given me a lot of peace of mind to be able to get vaccinated, to know that myself and my baby was going to be safe. And luckily, we were fine and he was born healthy, but it was stressful. So I just want to say to, those that are pregnant in our community that are on the fence, I know for me personally, it would have given a great peace of mind.
Thank you both. Elizabeth, do you have a
Yes. Yes. What resources are available in Humboldt County to get information, or how is Humboldt County reaching out to give this valuable information to people who are pregnant and want to know?
Yeah, so I think, really this is a decision between a patient and their doctor. And so as public health, we offer vaccines to everyone in the community who has made that decision. Certainly we, if a woman is seeking vaccination who's pregnant, we can definitely vaccinate them, or they can go to any of the vaccination sites across the county through myturn.ca.gov or through vaccines.gov. Because many of the prenatal providers wouldn't be able to, vaccinate. They don't have, they're not authorized COVID-19 vaccinators. But really, yeah, it's something that the medical community is aware of and would be promoting with their patients locally. I mentioned ACOG, which is the American College of Obstetricians and Gynecologists, and they've put out multiple position papers on this. And so most folks who are doing prenatal and obstetric care in the county would have access to those resources.
Thank you. Iridian, do you have another question?
Yeah, I do. I was wanting to ask Dr. Hoffman about his transition out of public health officer position. And so I wanted to ask you if you're doing anything personally to aid in the transition or getting ready to leave.
Yeah, I think Director Pereira might be able to speak better to the transition, but certainly we're doing a lot on all ends to prepare for this transition. Trying to make sure all the duties are covered, and I know they're opening a search and have arranged for coverage in the meantime. So Director Pereira, if you want to speak more to that.
Yeah, sure. Yeah, and Dr. Hoffman has just been so great in this transition, and we have Dr. Kate Eslin, I think, who I've mentioned before. She's been working as extra help and supporting our COVID response, and so she's going to continue to provide support there. And then we also have former health officer Dr. Baird, who also is going to support our non-COVID activities. So we have our public health clinic, we have vital statistics, and some of those other functions that maybe people don't know that we do here in public health. So providing some continuity there. And we'll definitely make it well known when the recruitment is open.
I did have a follow-up question for Dr. Hoffman. Do you have any advice for the person who's going to take over after you? Because this has been, I feel like a difficult time, for people to serve as public health officers. And so, yeah, what advice would you give them?
I think being a health officer is the greatest job I've ever had. it's by far been the most impactful to the patients in the community that I've served. So just knowing that going into it is, I think, reason enough for someone who wants to step into this kind of role. I think anyone who's thinking about it, just like I knew what I was getting into, probably knows what they're getting into. So it's a very rewarding job. It's a great group of people. The community is supportive, and just I think for me personally, it hasn't been the right time going forward. But someone who's making that decision at this point should know all of the details, and I think the only advice I would have is enjoy working with a wonderful group of people who really are dedicated to your community.
Thank you.
Thank you. Christina, do you have another question?
I don't, thank you.
Isabella?
Yeah, I am curious if public health can say how many children under the age of 18 are fully vaccinated or partially vaccinated at this point.
I don't have specific numbers. It's on our dashboard though. But it's, the under 18, I think we have it broken down into different age groups. So the 12 to 18-year-old group, the last I looked, was close to 50% fully vaccinated, like I think around 48, 49%. And for the 5 to 11-year-olds, it was around like 23, 24% fully vaccinated. So, and then a few more percentage points on each who are partially vaccinated with just one shot. For the 5 to 11-year-olds, we were slightly above the state median. And for the 12 to 18-year-olds, we're slightly below. So we're doing okay. This has been a really tough group to get vaccinated, though. I think rightfully a lot of parents have had second thoughts or misgivings, not understanding all the data that's out there and a lot of information that seems to be conflicting. I would just encourage everyone to look to their medical doctors and the respective medical organizations across the country, like the American Academy of Pediatrics, American Academy of Family Medicine. These are well-respected authorities on pediatric medicine, and they all recommend wholeheartedly to vaccinate all kids who are 5 and up.
Thank you. You took my follow-up question. And also I want to thank Sofia for touching on COVID and pregnancy. Thank you both very much.
Thanks, Isabella. Austin, do you have any more questions?
I have no further questions. Thank you so much.
Thank you. How about you, Ryan?
Thank you. Yes, I have one quick question about a provider communication that came out at the end of January, which informed local hospitals about the FDA's temporarily suspending emergency authorization, use authorization for the monoclonal antibody treatment made by Regeneron, just because it specifically didn't work for Omicron. And hopefully we are really past that now, but seeing as how people are still being hospitalized, could you just speak to that and what alternatives are out there in Humboldt for people? Yeah, thank you.
Yeah, great question, Ryan. So RegenCov, which is the combination monoclonal antibody, which had been primarily in the one we've been using in Humboldt County in that monoclonal antibody clinic from the beginning, going back to September. We knew it was losing ground against the Omicron variant. And we tried to hold on to it as long as we could because we knew there was still Delta around, and we didn't have very much of the other monoclonal antibodies, which do work against Omicron, which is the called Sotrovimab. We have since been able to increase a little bit the Sotrovimab. So I think it has been a little difficult though for a while. So they did also include remdesivir to that clinic, which is not a monoclonal antibody, but a treatment that was being used in the hospital. But it became more difficult because that remdesivir is required to be given over a 3-day period as opposed to just a one-time like the monoclonal antibody. So additionally, though, since the beginning of the year, we've been getting small amounts of 2 oral antivirals, one called molnupiravir, which is in a little bit better quantity. We've been getting more of that than we have the other called Paxlovid. But the molnupiravir doesn't work quite as well. It's only about 30% effective, whereas the Paxlovid is about 80 to 90% effective, nearly as effective as the monoclonal antibodies. So we've been getting those out to providers across the county for use. We do have increasing supplies of Paxlovid, and we're hoping that will be something that can really change the game going forward to reduce the need to go into a clinic for this treatment and be able to take these pills at home like you would a lot of other illnesses. So I think that's one of those shifts that I was talking about this week, and the board meeting was, more at-home treatments, more at-home testing, and better vaccination, knowledge that we have more coverage with people who've been infected and that their risk of hospitalization is lower if they get reinfected. I mean, all these things are going into these decisions about removing public health interventions that were more strict throughout the rest of the pandemic. So that's the background for the REGEN-COV and why it was suspended. And one more piece on that, just, we actually, that was suspended another time in the pandemic during the alpha surge, because it also didn't work against alpha. We didn't have any monoclonal antibody usage really here in the county at that point. So it didn't affect us as much, but it's not the first time. So that's why they said temporarily suspended, because if another variant comes along, like then Delta came along, it might be useful again.
Thank you.
Thank you.
Is that good for you, Ryan? Do you have another question?
Yeah, that covered it. Thank you.
Okay. Elizabeth, do you want to ask one more question before we sign off?
I'm good, thank you.
All right. Thank you guys all for being here. Thank you to our panelists and to our media. We will get you the recording as soon as possible, and have a great day.